my name is Takira Cunningham, and today's date is February 13th in 2020, and the time is 6:45 p.m. Today I'm going to be demonstrating how to suction and how to clean a tracheostomy tube. So I'm going to start off by providing patient privacy and hand hygiene. I've already introduced myself to the patient, and I've already explained the procedure. So I'm going to get started. I have my patient in high Fowler's position, and I have this towel on her so we won't make a mess. So I'm going to begin by opening my suction kit. Okay, now that I have that open, I'm just going to leave that right there. So now that I have my sterile gloves on, I am going to explain that me and my patient, we already have a mode of communication. So if the procedure is painful or causes her distress, she's going to lift her left arm. So now that my patient is getting hyperoxygenated, I'm going to go ahead, take the catheter out with my non-dominant hand. I want to pick it up, and I want to pick this up, and I want to connect it. So I already have my catheter on and my suction on, and my suction is set to 80 to 120. So just going to make sure my suction works, and it's showing that it's working. So with my non-dominant sterile hand, I'm going to come and get my normal saline. I'm going to pour it in here. I'm going to discard that. So now I'm going to put my catheter in the normal saline, and it's going to suction. Show me that it's suctioning. So now that I know my suction is working, I'm going to insert the catheter about 12 centimeters in, and then once I get in, I'm going to start suctioning. And as I'm suctioning, I'm just going to gently pull out and gently rotate. Pull out and rotate. So with that, I'm going to observe the drainage, and then with the suction, I'm going to clear the catheter. Then after like 1 or 2 minutes, and my patient's going to take 3 to 5 more deep breaths, I'm going to do the same thing. Insert it about 12 centimeters, and then gently rotate it as I take it out. All right, so now that is how you suction a tracheostomy. Now that I'm done, I'm going to disconnect it, and I'm just going to ball it up and throw it away. So now that I have done that, I'm going to come over here and turn off my suction. I'm going to perform hand hygiene, throw these items away. So now I'm going to get my kit out. I got my trach kit, and I got my sterile gloves. I'm going to bring my normal saline over. I'm just going to throw the top away. So now I'm just going to open the kit up. Right. So now that I have this open, I'm going to take this out. Lay it, and I'm going to lay it like that. So now that I have this out, I'm going to go ahead and put on my sterile gloves. gonna fix it. Alright, so now that I have both of my sterile gloves on, I'm now gonna go inside of my kit, take some things out, and I am going to now get everything situated. Make sure I got everything I need. So now both of my hands are still sterile. I am going to take the tube out gently. And my patient is getting hyperoxygenated right now. So I'm going to take that tube out, take the oxygen off, take the tube out, and then I'm going to pour normal saline, and then just throw this away. And then I got peroxide, and that one, throw that away. So now I have 2 normal saline and 1 with peroxide. I'm going to now come and pick up this cleaner thing. I'm going to now come over here and clean. Drop it back in there, clean it some more, and then drop it into the clean normal saline. So now that it's in the clean normal saline, it's back sterile. So I'm just gonna put that right back in. So now that I have that in, I'm going to loosen up his ties a little, and I'm going to take off the V-neck. So I'm going to just throw that away. So now that I have the V-neck off with my gauze, I'm going to put it in the peroxide, and I'm just going to clean around, clean her skin, going to wipe, throw it away. Wipe, and then throw it away. And then now I'm going to attempt to put her V-neck back, her V 4x4 back on. So now that I have her V 4x4, I'm going to put that on with 2 hands. So now that I have that on, I'm going to change her tracheostomy tie. This is the tie to keep the tracheostomy in place. I want to put this new one on her. So as I'm putting the little string through it, I want to make sure that I do not hurt my patient by being rough on the tube or anything. So you got to be gentle, because we do not want to knock the tube out. So I'm going to make sure that this is in place, which it is. I'm going to have my patient flex her neck a little, just to make sure it's not too tight, which it is not. Now that I am done with my suctioning and my tracheostomy care, I'm going to document the drainage of the secretions, the color, the amount. I'm going to document how well my patient was during the procedure. Did it hurt her? Any abnormal behaviors that I've noticed. And I'm going to put my patient bed back down. And I'm going to clean up, put the call light in reach, And I'm going to make sure my patient is okay and doesn't need anything. That is how you suction and that is how you clean a tracheostomy. Thank you.